The Board President Doyle calling the Oregon Board of Pharmacy board meeting back into order at 9:55. We will now move to general administration, speaking about at first mailing A with board member Melvin. Staff member Melvin regarding the rulemaking hearing report and comments.
Thank you, staff member Melvin. Again, this is mailing number A. Board members Hemmings and Vipperman and staff members Davis and myself attended the rulemaking hearing. 8 people joined the public call to listen, and 1 person signed up to provide oral testimony. 1 person actually provided testimony during the hearing. We received 7 written comments during the open comment period from December 22nd, 2023 through January 24th, 2024. And they have been provided to the board in their entirety. On December 22nd, 2023, I emailed the rulemaking hearing public notice via Gov Delivery to 4,353 rulemaking adopted rules subscribers. And I sent it to 22,739 licensee registrant subscribers. So it went out to a total of 27,092 subscribers. Interested parties were invited to sign up to provide oral testimony during the virtual hearing. They were encouraged to email written comments to pharmacy.rulemaking@bop.oregon.gov and had an opportunity to simply call in and listen to the hearing. Back to you for board discussion, President Doyle.
Member Doyle, thank you for the introduction, staff member Melvin. The floor is now open for discussion. If you would like to make any comments regarding this item, please raise your hand. Member Vipperman.
Board member Vipperman. And who was the testimony by? Was one of the associations, right?
Yes, staff member Melvin, I'll just scroll down to it so you can see here. Give me just a moment.
Oh yes, okay, well,
Sorry, there were a lot.
Sorry, I beg your pardon. Can't remember which one it was, but somebody.
So, I'm sorry, it's right here. It was Brian Mayo from OSPA.
He was nice enough to add all of the notes from the last board, the rulemaking to this one, and I can't tell you how much I appreciate that because I didn't have to go back and forth. So I just wanted to say a big thank you for that, and I enjoyed the conversation and the notes. Thank you.
Any other comments or questions? Hearing and seeing none, is there a motion to move to accept the January 24th, 2024 rulemaking hearing report?
Moved by board member Beeman. Seconded by board member Vipperman.
The motion has been moved and seconded. Roll call, beginning with myself. Board member Doyle, yes.
Board member Chin, yes. Member Beeman, yes. Member Barr, yes. Board member Hall, yes. Member Hemmings, yes.
Board member Joyce, yes.
Board member Vigil, yes. Member Vipperman, yes.
Motion passes. We'll now review proposed temporary rules to consider for adoption with staff member Melvin.
All right, staff member Melvin, again, this is mailing B related to Division 115 services on the pharmacist protocol compendium. The temporary rule amends existing rule OAR 855-115-0345 by adding the current protocol versions, including vaccines from Division 20. And this would become effective on March 1st, 2024. And I'm going to turn it over to staff member Davis for additional comment.
I have kind of my normal. So this is discussion item B is a boy. It's the board's first review of a temporary rule amendment. In August 2023, the board adopted OAR 855-115-0345, which takes effect on March 1st, 2024. Since then, the board has adopted over 20 vaccine protocols that were effective February 1, 2024 into Division 20. This temporary rule aims to add these vaccine protocols to the protocol compendium in Division 115. And that would mean we are adopting each of these as a standard adopted by reference. Unfortunately, the Oregon Administrative Rules Database, or OARD, limits us and prevents us from amending OAR 855-115-0345 until after March 1st, because the rules aren't effective. You can amend a rule that's not effective. Therefore, with board approval, a temporary rule will be filed and then take effect on March 1st. This will ensure that pharmacists can continue providing vaccines without interruption. Obviously, delaying implementation could limit patient access and care, increase public health risks by leaving people vulnerable to preventable diseases and overburdening other healthcare providers. At the April 2024 board meeting, the board will then consider sending a permanent rule amendment to the May rulemaking hearing to adopt in June for permanent effective. So we just need a temporary patch to get us through until we can file a permanent rule. So the language in the rule you can see on the screen in 855-115-0345. These protocols are identical to the ones that were just adopted into Division 20 with a couple of minor changes. In paren H, big letter A, the standard protocol for all vaccines, there's a minor difference between the Division 20 version and Division 115 version, which is why we did include it in your packet. It's the rule numbers that are listed on the cover page are different because under the authority and purpose for pharmacist training and education section. So we can't reference Division 20 rules because those won't exist. So we put in the Division 115 rules. Same thing in paren B, the rule numbers listed on the cover page are different under the authority and purpose and the pharmacist training and education sections. And then under paren D for the coronavirus 2019 vaccine, again, the rule number changes were made. So there's kind of like a statutory minor correction, like just changing the rule numbers, but we did want to point out that we had changed some of the Division 20 to Division 115. That's all the changes to the protocols, otherwise they are identical. Back to you, President Doyle.
Member Doyle, the floor is open for discussion for board members. If you have any questions or comments, please raise your hand. And hearing none, is there motion to move to adopt temporary rule OAR 855-115-0345 to be effective March 1st, 2024? Board Member Bean? I will withdraw the motion from the floor. We'll move back to discussion. Board Member Beeman?
Apologize, I was looking at the wrong document. Go ahead. Sorry.
Member Doyle speaking. Is there a motion to adopt temporary rule OAR 855-115-0345 to be effective March 1st, 2024? Second. Seconded, Board Member Joyce. It has been moved and seconded. I will now call for votes. Board President Doyle, yes.
Board President, Board Member Chin, yes. Member Beeman, yes. Member DePalma, yes. Member Hall, yes. Member Hibbins, yes.
Board Joyce, yes.
Member Patil, yes. Board Member Vipperman, yes.
Motion passes. We'll now move to discussion of mailing Bravo 1 protocol compendium. Staff Member Melvin.
Thank you. Give me just a moment here. All right. Staff Member Melvin, again, this is related to Division 20's protocol compendium. This temporary rule would temporarily suspend OAR 855-020-0300 effective 2/29/2024 at 11:59 PM to allow for the adoption of the temporary rule the board just discussed, OAR 855-115-0345, to be effective 3/1/2024. Which again, it just proposes to adopt the current protocol version, including the vaccine. Staff Member Davis.
Discussion item B1. So this rule was recently amended at the December 2023 board meeting with an effective date of February 1, 2024. The effective date, or that effective date, prevented it from being included in the broader repeal of the Division 20 rules, because you can't repeal something that's currently not effective. So we had to wait until after February 1st in order to do this, so we just need to temporarily suspend the Division 20 rules so that there aren't conflicting rules between Division 20 and 115. In addition, the rest of Division 20 will have gone away. It would literally be this last rule standing. And so this is just a temporary suspend. At the April 2024 board meeting, the board will consider sending the permanent rule repeal for this rule to the May rulemaking hearing to adopt in June, to be permanently effective upon filing. So this is just, we just temporarily adopted the changes in 115, and now we need to temporarily suspend Division 20, and then we'll do all the formal permanent rulemaking starting at the next board meeting. Back to you, President Doyle.
Board Member Doyle, the floor is open for discussion among sports members. First question is with regard to a likely motion. Is the correct language for the motion to move to suspend the rule? Or is it?
Yes, you are correct.
Okay.
Thank you.
Are there any other questions from board members, please? Raise your hand. Member Vernon?
This board member. So, you know, when we look at these rules, we usually have the numbers that we're going to, have a paper that the numbers that we're going to, vote on. And I see that it is not in our agenda, and it was not on the written agenda, which is what I just got. That's something new because I can't know if I can do that without like the numbers. When I vote, like we look at the numbers, we make sure the numbers are okay. Did anybody else notice that we didn't have those? I'm just concerned about that.
Board Member Doyle, thank you for your question. Board Member Vipperman, there's been a process change in what you are referring to as the working agenda, and it is the working agenda that you don't have access today, which has a list of all the OARs, which I would be reading, asking for a motion to accept or deny. I asked AAG Hunt to offer some additional reflection on this change.
So I see your concern because on the agenda, just as the division, and when it refers to the mailing number. So I think the idea was that you could look at the mailing number and know which one it was. But going forward, we could put the full number on the agenda. I just was thinking we would look at the mailing number. So like this is B1, so you could look at B1.
Okay, so, and there's several different numbers in there, and when I vote on a rule, I go down and mark every one of those numbers to make sure that they're okay. That's important to me, and it's not on there. And so I'm not gonna be comfortable agreeing to a rule that I can't see the numbers that I am voting on. And I'm sorry if everybody doesn't feel that way, but.
I believe I saw Board Member DeBarmore's hand go up first.
Board Member DeBarmore, I agree wholeheartedly, especially when we get to rule packages where we have 20, 30, 40 rules that are listed for the motion. At least in my past short time I'm here, if we don't have that available, I will things down significantly because I have the same concern. I want to make sure each rule is, I understand what I'm voting on and that it's clear to me which rule it is. And if I'm having to follow the rule package, rule by rule, I have to slow down the motion significantly.
Yeah, we're all on a little, at one member government.
Is your microphone?
We can all in a little square and we could follow it. If I have to go down every one, it is going to take a long time. Sorry,
Member Patel.
Board Member Patel, I echo the same concern. It's just because sometimes we get the rule package like, and a concern for certain rules, not all of them. And it's important for me to mark down. I'm like visual person, so it's nice to have those number written and give it to us ahead of time. Thank you.
Executive Director Fox.
You, President Doyle and members of the board, we hear the will of the board and at the next meeting, we'll add it to the open agenda.
Board Member Vipperman, there is the listing, for example, in package B1, there will be the listing of the rule number that is here, and you can slowly scroll along to verify the numbers. So that's what we'll have to do at this time. Luckily, there are no more than, it looks like 10 at a time that we're discussing, so we should be able to accommodate your request.
appreciate that. Thank you so much.
Any other questions related to package Bravo 1? Hearing none, is there a motion to move to suspend rule OAR 855-020-0300? I'm asking for some assistance with staff, what the recommended date nomenclature is.
Effective 2/29/2024 at 11:59 PM.
Oh, that's. PM.
There a motion to move to suspend rule OAR 855-020-0300 effective February 29th, 2024 at 11:59 PM.
Board Member DeBarmore.
Seconded, Board Member Joyce. Have been moved and seconded. Board Member Doyle, yes.
Member Shane, yes. Member Beaman, yes. Member DeBarmore, yes.
Member Hall, yes.
Member Evans, yes.
Member Joyce, yes.
Member Patel, yes.
Member Vipperman, yes.
Motion passes. We will now review proposed draft rules to consider for adoption with staff member Melvin, package Charlie.
Thank you, staff member Melvin. And this is mailing C related to the repeal of the Division 01 procedural rules. Again, this repeals these rules in its entirety effective at 11:59 PM on 2/29/2024. The board adopted the new Division 104 universal rules in August of 2023, which replaces Division 1. These rules need to be repealed to allow Division 104 to become effective on 3/1/2024. Back to you, Board President Doyle.
Board Member Doyle, the floor is open for discussion. Do any board members have questions or concerns? Hearing and seeing none, I will ask for the following motion as we scroll slowly through the package of approximately 4 pages. Is there a motion to move to repeal proposed rules OAR 855-001-0000, OAR 855-001-005. Again, I repeat, 855-001-0005. OAR 855-001-0012, OAR 855-001-0016, OAR 855-001-0017, OAR 855-001-0035, and OAR 855-001-0040 to be effective February 29th, 2024, 11:59 PM.
I'll move board member Chin.
Seconded, board member Joyce.
Have been moved and seconded. Roll call vote, board member Doyle, yes.
Board member Chin, yes.
Member Beaman, yes. Member DeBarmore, yes.
Member Hall, yes. Member Hemmings, yes.
Board Joyce, yes.
Yes. Member Whitperman, yes.
Passes. Have transition to package Charlie 1 with staff member Melvin.
Thank you, staff member Melvin. Again, mailing C1, this is related to Division 6 definitions. Proposes to amend existing definitions for certified organ pharmacy technicians and pharmacy technicians, counseling, DUR, and interns. It moves tamper-resistant prescription into Division 6, 0005 and proposes to repeal OAR 855-006-0015. Back to you, Board President Doyle.
Board member Doyle, thank you. The floor is open for discussion amongst board members. Do you have any questions or comments with regard to package Charlie 1? Please raise your hand. Board member Doyle, I have one question for staff to provide impact or input on. And if in line 14, or sorry, subpara 14 on line 70, counseling or counsel means an oral, electronic, or written communication between a pharmacist and a patient or a patient's agent in which the pharmacist provides the patient or patient's agent with advice regarding the safe and effective use of a drug or device. Is changing the language from oral, electronic, or written communication, rather use any form of communication. Would that be a significant change that cannot be promulgated at this time?
Staff member Davis, just something to consider for the board is that that would also then include things like nonverbal communication. And that, I think if it was to include that, could be potentially significant. I don't think that was your intent to include nonverbal communication, so, yeah, that's where I'll leave that.
Board member DeBarmore?
Remember DeBarmore, but sign language would be nonverbal, and that would absolutely be what we would need. Oral, electronic, or written isn't verbal.
Council, you're gonna have to weigh in on this then. That's a good point. Of course.
Obviously, I don't think you guys did any non-verbal communication, other than obviously actual communication, right? So like, you're not in a situation like that. I believe what the board would do that you could either change it to any communication, or we can come up with. Wow.
DeBarmore?
Remember DeBarmore, I'm just not sure why we have to get so prescriptive, and can't we just say communication? We've gone round and round it with this, and we. Okay. have to get down to the granularity of it because we have a list. We could have a list of 27 things long if we truly get down to that.
AG Hunt, you believe that would be a significant change?
I don't believe it would be a significant change.
Staff member Davis?
AG Hunt has the last say on that, so.
Just board member Chin, I just had a question, because we always think about, patient safety being job one. If there were and please tell me this is a job, I know that you think of that as well, but if we say, communication sufficient for patient safety, is that needed? Is it that's the
Board member DeBarmer, it says for regarding the safe and effective use. Defer to others too, with one voice.
Staff member Davis had indicated that there could be impact in other areas. You might have some examples on the tip of your tongue that you could share? No.
I defer to AAG Hunt. It's not massive, then we can make the change.
Member Patel?
Board member Patel, I also echo board member Devamar, yes, it should be just the communication, list the word, list the prescriptive names of the rule is better for the patient safety.
Member Hammond.
Member Evans, please.
So what you are proposing is it would read counseling or counsel being communication between a pharmacist and the rest of it. So you're requesting to remove oral, electronic, or written.
Member Doyle, I brought the question up because it was part.
Right, this board member DeBarmer, he did start the conversation asking to change it to any communication.
Oh, you did? I thought you said to include other form, whatever. It's okay.
Board member Doyle, in part of the testimony that we received with regard to the rulemaking hearing. I reflected on that feedback, and I first wanted to ask the question if it would be a significant change, as we cannot make significant changes to language that's here unless we go back to rulemaking hearing. And so I'm trying to invite the board to have further discussion as to the appropriateness at this time of changing the language that we had previously agreed upon. Board member DeBarmore brings up an interesting consideration about American Sign Language's communication, and therefore what I'm trying to understand or forecast what the ramifications would be for the rest of the rules if we were to change from oral, electronic, or written to be just any form of communication.
Board member, and then board member DeBarmore. Your concern was that this was too prescriptive.
Member DeBarmer, that's been my concern all along.
Board member DeBarmore, so you are alluded to that a pharmacist would know what communication means.
Board member DeBarmore. a pharmacist
Disagree.
should be able to determine with the patient or patient's agent what the best form of communication is to ensure there is an understanding of safe and effective use of a drug.
Board member Hennig, that's kind of what I'm getting to is what is the purpose of counseling, right? Counseling is about the patient, not about the pharmacist in terms of the intent is. This is really about whether or not providing well, it's not guidance, rules to pharmacists, counseling, the communication needs to meet the needs of the patient.
I agree with that.
Board Member Joyce, I support this revision, the striking of and oral, electronic or written, and just leave it with communication. Communication to me encompasses every type of communication, rather than being specific to oral, electronic, and written. So when you just have communication, it includes ASL and every other form of communication. I want to be overly prescriptive here. Board Member Doyle, Staff Member Davis, I recall conversations about different methodologies for communication. They may not have applied to counseling or other areas. I'm asking for your assistance if you can help refresh my memory, but we had talked about text messages in certain areas. And I believe that the public comment through rulemaking hearing was that that type of language should not be included in some areas. Am I ringing any bells for you?
Staff Member Davis, I recall the board did have discussion that text messaging would be considered a form of electronic
Okay.
communication, as long as it was a two-way type of a communication. It had to be a between, and we have that word between the pharmacist and the patient. It had to be not just a one-way type thing. And that was why the word between is in there.
Thank you. Yeah, you clarified the pieces that I'm trying to put back together from previous conversations. Is there a motion to amend para 14 counseling or counsel means communication? Let me rephrase that. Is there a motion for para 14 to edit that to say counseling or counsel means any form of communication between a pharmacist and a patient or a patient's agent in which the pharmacist provides the patient or patient's agent with advice regarding the safe and effective use of a drug or device? Board Member Bean.
Member Beeman, just a quick clarification question. You had put in there any form of communication. And this is directed to AAG Hunt. Would that be substantive? More so than striking it?
Microphone, please. Microphone, please.
I was just taking out those three words, and so any form of is fine, or striking it either way.
Thank you, just wanted to.
Member Evans.
Member Clemens, I think any form runs into problems versus just communication.
Thank you. I've asked for a motion and I am waiting for a moment to see if there's a motion for that. If there is none, then we can propose a different motion.
Right, can you repeat?
I asked if there was a motion for, changing line 70, para 14 to counseling or counsel means any form of communication between a pharmacist and a patient, et cetera, et cetera. Member Chin?
Board Member Chin, who's clean, does not have any extra words in there, and the way, and you can't see it because it's behind you. But the way it's the way it's changed two different ways, on the behind you, just taking out the prescriptive language and leaving means communication period is sufficient, rather than adding maybe. And adding additional verbiage that may or may not be confusing.
Board Member Via?
Member Beeman, I motion to amend para 14 to read counseling or counsel means communication between a pharmacist and a patient or patient's agent in which pharmacist provides the patient or patient's agent with advice regarding the safe and effective use of a drug or device.
Board Member Joyce seconds. A motion has been made and seconded. We'll go around for roll call. Board Member Doyle, yes.
Member Chin, yes.
Member Beeman, yes.
Member DeBarmore, yes.
Member Hall, yes.
Member Hemmings, yes.
Board Member Joyce, yes.
Member Pajil, yes.
Board Member Viberman opposed.
Motion for the edit carries with Board Member opposed. There are motion to move to adopt proposed amendments in OAR 855-006-005. As
That's provider.
Member Doyle, is there a motion to move to adopt proposed amendments in OAR 855-006-0005 as amended? And to repeal OAR 855-006-0015 to be effective March 1st, 2024.
Member Chin, second.
We have been motioned and seconded, calling for the roll call. Board Member Doyle, yes.
Member Chin, yes.
Member Beeman, yes.
Member DeBarmore, yes.
Member Hall, yes.
Member Hemmings, Board Member Joyce.
Board Member Joyce, I want to, are we able to start over? I wanted to review another line and see if it's substantive change. Is that possible? I wanted to review line 41 regarding CDTM. The language in that definition. That would it be substantive change to strike after the word protocol? Do we need to be that specific? Is that specificity there necessary?
Member Doyle, there are otherwise talking about CDTM in other places today, and I don't think it would be a wise idea to have that change at this time until the conversations with regard to the other packages be addressed. Okay. Member Patel?
Member Patel, I also have the same concern as Board Member Joyce. That's what I was thinking. Should I raise that concern right now or the later in the package? But then I was thinking this is the definition, so I think it's appropriate to make those changes right now in the definition. That's what my thought. And I also have the same thing, like strike the rest of the thing and add one more word, pharmacy. I don't know how I don't know how substantial change it will be. I at first
Remember Doyle, when you're talking about striking the rest of the thing, et cetera, I think that would be a substantive change. We're having concurrence with Executive Director Fox and AAG Hunt.
Staff member Davis, in addition, this rule was not noticed as an amendment. There is no change that was noticed in the rulemaking. So we would have to start a rulemaking process to modify this definition.
This is Board Member Joyce. I just see this as something that is similar to what we just reviewed, in that we are going from something very specific and prescriptive to something more broad. And so when we're striking all the specific verbiage here, and making it more broad and less prescriptive, it's similar to what we just did with the word with counseling. And so when we're discussing CDTM and we're talking about specific dosage, frequency, duration, route of administration of drug, we're being very specific and prescriptive. Do we really need to? And so I see it as something similar to what we just discussed. However, if that's the view of the staff.
Staff member Melvin, again, this rule was not noticed to the public with any changes at all, so we can't just make changes on it right now. The board could initiate rulemaking again and send it to a May rulemaking hearing, but not in this portion of our agenda. And it's not on our agenda, I believe, for discussion later today.
Board Member Hammond, so how did we make the other change just now?
Okay, I'll pull up the filing and show. Thank
One at
you.
a time, thank you.
I'll pull up the filing so we can show you what was sent to rulemaking hearing as far as what was proposed and what was not.
It was just for a reminder for context. We had proposed initially back when we started talking about changing that definition, because you're right, there's a lot of prescriptiveness in it, and backing it out and changing it. But then with all the comment we got, the board decided not to move forward with that rule change at December board meeting. We did not make any, we decided, given to keep CD as is, not touch it. We will touch it. And we have that discussion a little later today, because we had just put into rulemaking the rule that's currently on the books at 19. So your point is heard, and we actually had done some of that work, but it was not included in this filing because the direction from the board at the December board meeting was do not change CDTM, keep it as is, and we'll come back and work on it again at a later date. But we have to have this rule on the books for March 1st. Otherwise, we would lose the ability to do CDTM. So staff member Melvin showing you the filing, and you can see parent 10 has no edits or modifications to it. So there was no notice to the public of a potential change for that rule, for that subsection within the rule. I think that's probably the more correct language.
Staff member Melvin, are you also able to show the notice for how para 14 was
Sure.
noticed to the public?
Yes.
How that compares and contrasts to CDTM?
Yes, again, anything with an underlined is a proposed amendment.
Member Evans?
Okay, so Board Member Hammond, just so I understand what's happening. In the definitions that we just went through, we made a change. Why is that different from this?
Again, because we noticed the public that the board was interested in amending the definition of counseling. As you can see, the underlying version is telling the public what wanted to put out for public comment. And with the AAG's assistance, yes, so what you're going to see is the final version of what will be adopted will be, you will not see this language here. The board just adopted the rule to be filed without means an oral, electronic, or written, because this was open for comment and it went through the process, we are able to adopt it with those suggestions. However, CDTM was not noticed. We did not have that open for public comment, so the public had no opportunity to provide comments to us. So everything that's underlined, Board Member Hemmings, means it was open for public comment and it went through the process of rulemaking hearing. Does that help?
Thank you for that, clarification. So in order, if board member Joyce and Patel wanted to make changes to the definition, right? They would have to propose that now that it goes to rulemaking.
Board Member, that would need to be added to the board meeting agenda and brought up during that discussion. And then, yes, the board would go through and agree and deliberate if they wanted to send it to rulemaking hearing.
That makes sense.
This is just my understanding when I'm looking at this. What given in the mailing, but we're getting doesn't have all that. So should I be referring to the, when I'm given something else? Doesn't have the underlying and all that, but it's just hard to keep track.
Board Member Doyle, there are limitations with regards to filing and when rules are finally presented for our viewing, present final state without edits, if you will, or tracked edits. And board staff recognize that concern, both for the public and also for board members' concerns. And if you were to track down in mailing C1 at the top of 85500600005, it says "View current rule on the SOS website, 12/22/2023, notice of proposed rulemaking." That's a hyperlink, and then that will take you to the underlined or modified version that you can actually see how things have been changed.
Member Hemmings, can I just say that this whole process is very confusing? So, yeah.
Board Member Doyle, again, I'm asking if there is a motion to move to adopt proposed amendments in OAR 85500600005 as amended today, February 9th, 2024, and to repeal OAR 85500600015 to be effective March 1st, 2024.
So moved, Board Member DeBarmer.
Second, Board Member Chin.
We'll now call for a vote on the motion. President Doyle, yes.
Member Chin, yes.
Board Member Beeman, yes. Member DeBarmer, yes.
Member Hall, yes.
Member Hemmings opposed.
For Joyce opposed.
Member Patel.
Yes.
Member Vipperman opposed.
Motion carries with Board Member Hemmings, Joyce, and Bipperman opposed. And we have now moved on to discussion of package Charlie 2, Staff Member Melvin.
Thank you, Staff Member Melvin. This is regarding Division 10. It would repeal Division 10 Board Administration and Policies in its entirety, effective at 11:59 p.m. on 2/29/2024. The board adopted new Division 102 Board Administration rules in August 2023, which replaces Division 10. Division 10 again needs to be repealed to allow Division 102 to become effective on March 1st, 2024. Back to you, Board President Doyle.
Member Doyle, the floor is open for discussion regarding package Charlie 2. Questions or comments, please raise your hand. Seeing and hearing none, is there a motion to move to repeal OAR 855-010-0005, OAR 855-010-0015, OAR 855-010-0016, OAR 855-010-0018, 855-010-0021, OAR 855-010-0035, OAR 855-010-0100, OAR 010-0110, OAR 855-010-0120, and OAR 855-010-0130 to be effective February 29th, 2024, 11:59 PM.
So move, board member Chin. State one. 5010. 10.
Is there a motion to move to repeal OAR 855-010-0005, OAR 855-010-0015, OAR 855-010-0016, OAR 855-010-0018, OAR 855-010-0021, OAR 855-010-0035, OAR 855-010-0100, OAR 855-010-0110, OAR 855-010-0120, and OAR 855-010-0130 to be effective February 29th, 2024, 11:59 PM.
Board member Chin.
Seconded, board member Joyce.
We'll now call for a vote on this motion that has been moved and seconded. Board member Doyle, yes.
Member Chin, yes.
Member Newman, yes.
Member DePalma, yes.
Member Hall, yes. Member Henry, yeah.
Member Joyce, yes.
Member Patel, yes.
Member, yes.
And 3, staff member Melvin.
Thank you, staff member Melvin. Again, mailing C3. This proposes to repeal rules in Division 19 effective 2/29/2024. The board adopted Division 115 in 2023. Division 19 rules need to be repealed in order for Division 115 to become effective 3/1/2024. Back to you, Board Member Doyle.
Questions or comments from the board members? Seeing and hearing none. Is there a motion to move to repeal OAR 855-019-0100, OAR 855-019-0110, OAR 855-019-0120, OAR 855-019-0122, OAR 855-019-0123, OAR 855-019-0124, OAR 855-019-0125, OAR 855-019-0130, OAR 855-019-0140, OAR 85501900150. OAR 85501900160. OAR 85501900170. OAR 85501900171. OAR 85501902200. OAR 85501902205. OAR 85501902210. OAR 855019020. OAR 85501902230. OAR 855019024. OAR 855019025. OAR 855019026. OAR 855019025. OAR 855019030. OAR 855019031. OAR 85501900460 to be effective February 29th, 2024, 11:59 PM.
Board Member DeVarmo.
For a second,
Second, Board Member Beaman.
has been moved and seconded. Roll call follows. Board President Doyle, yes.
Member Chin, yes.
Member Beaman, yes. Member DeBarmore, yes.
Member Hall, yes. Board Member Hemmings, yes.
Member Joyce, yes.
Member Pritchard, yes.
Member Bibberman, yes.
Motion passes. Now move to package Charlie 4, C4 with staff member Melvin.
Thank you, Staff Member Melvin. This is related to Division 20. Just a minute. Proposed to repeal rules in Division 20, effective again to 2024. The board adopted Division 115 in 2023. Rules in Division 20 need to be repealed in order to allow Division 115 to become effective March 1st, 2024. Back to you, President Doyle.
Board member. On the questions, board member Evans.
Member Hemmings, so just so I can understand, the process. So when you say that the board, the board did something in 2023.
They adopted the Division 115 rules.
So when the board adopted the 115 rules in 2023, those rules were not gonna go into effect until March of 2024.
Correct. Yes.
If they're okay. And therefore, you have to repeal the old rules in order for those new rules to go into effect. Okay, got that.
Correct.
So my question is, the adoption of the new rules, the board adopted those rules. Why does it take until March for it to go into effect?
Staff Member Davis.
Staff Member Davis, the board actually requested that there be a delay in the effective date to give pharmacies time to be ready for the new rules. And so I think at the time it was discussed like 6 months was something like that. So that was why we picked March 1st, was so it gave people time to read the new rules and change their operations as needed to be ready.
Thank you. So when we send out a notification to all licensees that this is the new rule and it's going to be effective, let's say 6 months from now, do not hold the licensee accountable for following those rules until the effective date. Right? Does that preclude the licensee from actually implementing or acting on those rules during that 6-month period?
Staff Member Davis, yes, they would still need to follow the rules that are currently effective. They can't begin following the new rules.
Thank you, everyone.
Board members have other questions? Seeing and hearing none, is there a motion to repeal OAR 85502000110, OAR 85502000120, OAR 85502000200 to be effective February 29th, 2024, 11:59 p.m.
So move board member Chin.
For a second,
Seconded, board member Joyce.
been moved and seconded. I will now call for a roll vote. Board President Doyle, yes.
Member Chin, yes.
Member Freeman, yes. Member DeBarmer, yes. Member Hall, yes.
Member Hemmings, yes.
Member Joyce, yes.
Member Pachel, yes.
Member Zipperman, yes.
Motion passes. Now move to package Charlie 5 with staff member Melvin.
Thank you, Staff Member Melvin. This is related to Division 25 Pharmacy Technicians. This proposes to repeal rules in Division 25 effective 2/29/2024. The board adopted Division 125 in 2023. Rules in Division 25 need to be repealed again to allow Division 125 to become effective March 1st, 2024. Back to you, President Doyle.
Member Doyle, thank you. The floor is open for board questions and comments. Seeing and hearing none. Is there a motion to move to repeal OAR 85502500001, OAR 85502500005, OAR 85502500010, OAR 85502500011, OAR 85502500012, OAR 85502500015, OAR 85502500020, OAR 85502500023, OAR 85502500025, OAR 85502500030, OAR 85502500035, OAR 85502500040, and OAR 85502500050 to be effective February 29th, 2024, 11:59 p.m. For a second,
Second board member Chin.
we'll now call roll after having the motion been made and seconded. Board President Doyle, yes.
Member Chin, yes.
Member Freeman, yes. Member DeBarmer, yes. Member Hall, yes.
Member Hemmings, yes.
Member Joyce, yes.
Member Pachel, yes.
Member Zipperman opposed.
Motion carries with board member Zimmerman opposed. It is now shortly before 11 a.m. We are scheduled for a break at this time. We will resume open session at 11:15 a.m.